All attendees are in listen-only mode.
Welcome to part 2 of the Injury Data and Needs Assessments webinar in the Pan Pacific Safe Communities webinar series. My name is Tracy Earle from Safe Communities Foundation New Zealand, and I'd like to introduce our presenter. Tanya Van Sittert is the Safer Melville Coordinator at the City of Melville, which is a local government area in the southern suburbs of Western Australia. It's the third largest local government authority in the metropolitan region. Tanya has worked in local government in the area of community development for 10 years. She recently supported the Safer Melville Advisory Committee to align to the Safer Communities framework and was involved in identifying data sources which were used to host a priority setting workshop to identify the community's injury and safety priorities. So now I'll hand over to Tanya to share her work with you.
Thank you very much, Tracy. As Tracy said, my name is Tanya. I'm the Safer Melville Coordinator here at the City of Melville. And today I'm just going to be talking briefly through the process we followed to identify priorities for the 2017 to 2021 Safer Melville Plan. I'll start with a bit of a background. We had a 2012 to 2016 Community Safety Crime Prevention Plan, which was successfully implemented. And safe and secure was one of the aspirations identified by our community in the city's strategic community plan. This highlighted to us the importance of reviewing that community safety crime prevention plan and developing the 2017 to 2021 Safer Melville Plan to achieve our community's aspiration. Obviously, a key aspect in the process of developing the Safer Melville Plan was to identify our community's safety priorities. The priority setting process we followed had 4 key milestones. They were identifying data sources, using data to identify high-level priorities, community and stakeholder engagement, and analysing data to inform goals, objectives, etc. My presentation today is going to outline what we did under each of these key milestones and how it helped us to set our priorities. So there is a lot of data out there that you can use to help set your priorities. The first step is identifying all of these data sources. For the development of our Safer Melville Plan, we identified these data sources. They were crime statistics from the WA Police, major causes of hospitalisations and total deaths from the Department of Health, and then feedback from a number of City of Melville community surveys or statistics that we had on hand. Our Safer Melville Advisory Committee actually defined the scope of safety when we started aligning to the Safe Communities framework. This really helped us to refine the types of data sources we would be including in our priority setting process, because otherwise it can be very, very overwhelming. So you know what data you have. Now you need to use that data to identify some high-level priorities. We conducted this high-level analysis in-house. At this stage, you also need to identify whether your data tells you enough to be able to plan projects to address them, or if you need to unpack the priority further. We identified that we did need to unpack some of our data further, and so to do that, we decided to host some stakeholder engagement. So as you can see from the table, the crime statistics really told us enough information for us to be able to clearly identify priorities. So we didn't need to do any stakeholder engagement for that particular data source. For the priorities that came out of our major causes of hospitalisations and deaths, a lot of the data did tell us enough, but for the transport crashes priority, we needed to unpack that further. So we realised that we needed to do some stakeholder engagement on that priority. The Community Wellbeing Survey is a City of Melville survey which is conducted every 2 years, and it's to understand the perception of a number of things related to community wellbeing in the City of Melville community. A couple of findings that came out from that survey, we realised that we needed to understand them a little bit more to be able to identify actions to address them for our community. And the Community Business Perception Survey is a satisfaction survey with City of Melville services in various levels of service that we provide. So that highlighted to us that there was lower satisfaction with safety and security in our business community compared to residents, and we realised we needed to understand that further to be able to identify priorities related to that. In the review of our strategic community plan, feeling safe and being safe was very important. We needed to understand a little bit more about where people did feel safe and didn't feel safe to be able to identify priorities for our plan. And our graffiti removal and vandalism repair statistics indicated that the majority of reports for the graffiti were being made by the city's community safety service officers. So we realised we needed to do some engagement to understand if people realised how to report graffiti so that we could identify if that was a priority in our plan moving forwards. The next stage or the next milestone is community and stakeholder engagement. We developed an engagement plan to ensure that we identified all of our stakeholders and how we were going to engage them. Some of the key actions we implemented were interactive workshops with two committees, one being the Safer Melville Advisory Committee, the other being our Road Safety Travel Smart Committee. This was to help us develop questions for a community survey to unpack those high-level priorities which we knew we needed to understand better. We also established an internal reference group which was made up of staff who would have a role in implementing the plan. The reference group finalised the questions for the community survey. They also assisted in developing content for the plan, and they reviewed and provided comment on the draft plan. We also hosted some community engagement. This was involved an online survey, face-to-face interviews at our Safe Day Out event, which we hosted in the local park, and an interactive map where people could pin areas they felt unsafe in the city of Melville and why. And then obviously coupled with that was a marketing and communications plan. This was to let everybody know how they could contribute to the survey and the map, and it included advertisements in the local paper, social media posts, flyers and posters, and a number of other promotion mediums. The next step was using all of the data that we had now obtained from our community surveys and our maps and our face-to-face interviews to set our priorities. At this point, we engaged a consultant for this lower level data analysis. They are actually a lecturer in criminology at one of the local universities. They analysed the findings for us from the community survey as well as the crime statistics in detail, and they provided a report summarising the findings. This now gave us enough information to develop broad goals and underpinning objectives and targets for the Safer Melville plan. So the table you can see shows the link between the data source, which identified the priority, the broad goal, and a high-level aspirational target. This is just a snapshot of the plan. The full version will be uploaded to our website because the plan was actually just endorsed last night by the Safer Melville Advisory Committee. But as you can see, the goal is very much linked to the aspirational target. So we're trying to reduce household crime and we're going to be comparing year to year to see if we achieve that. The same with business crime, the same with preventable injuries. We were trying to reduce transport crashes. We want to create safe and secure places and environments. So this is all related to graffiti and vandalism and designing out crime in the city of Melville. Goal 6 is all about creating a place where people feel safe and secure in all places at all times. So we are going to be aiming to increase the percentage of people who feel safe in the local area. And that's a question that is asked in our community wellbeing survey. So that's the indicator that we'd be using to measure that. And then the last goal is being prepared for an emergency. So we would be hoping to achieve that we get an increase in the percentage of people who report feeling prepared in the event of a local emergency. So my take-home tips, I guess, for priority setting are to treat priority setting like a project. There are lots of steps involved, and by treating it like a project and applying project management, you can break it down into key milestones and timeframes, which will make it less overwhelming. Second tip is to don't rush. If you want to do the priority setting process justice, then you need to take your time. My third tip is to know your organisation's skills and knowledge. Identify who can help you with various parts of your priority setting process. For example, is there somebody who can help you with high-level data analysis? Is there somebody who can provide advice on community and stakeholder engagement? This will help you identify gaps in skills and knowledge, and therefore what parts of the process you need to involve consultants and you need to source budget for. And the last take-home tips is engagement is key. Don't embark on the priority setting process alone. Identifying and involving the right people in the process will give validity and value to your priority setting process. Thanks for your time. I hope you found this useful. If you'd like more information, please feel free to contact me directly, or you can visit our website for the full version of the plan or any other information on our Safer Melville program. Thank you.
Well, thank you, Tanya, for your sharing. You've certainly given everybody a really good practical perspective on setting priorities. If any of the listeners have any questions for Tanya, please email them to the address on the slide, or you can email Safe Communities Foundation New Zealand and we're happy to pass them on. Thank you. I hope you enjoyed the webinar.